name is Dr. Preeti Anand, and today we'll be seeing a case about a station about the sexual and reproductive health module. And the station we are going to perform, I'm going to perform is with Dr. Meenakshi. She's going to be my role player, and we are going to present one case. And let's discuss later on that how much the things went right, what were the mistakes, how can we improve our presentation in exam. So just starting with the small quote, if you are not willing to learn, no one can help you. If you are determined to learn, then no one can stop you. So let's start your journey with a small presentation of a SRH module. There's a small station which we are going to present today. Okay, shall we start, Meenakshi?
Yes, ma'am.
Okay. So I'm going to be the candidate and Meenakshi is going to be my role player. So we'll be presenting to you the case and thereafter we'll discuss that how the things go on in the exam. So let's start, Meenakshi. So, hello, I'm Dr. Preeti. I'm one of the exam candidates. May I please confirm your name and age?
Hi, doctor. I'm Sophie and I'm 22.
Okay. How would you like me to address you?
Sophie is fine, doctor.
Sophie, you can call me Preeti. Sophie, I can see that you are little not unwell. Shall I give you some medicines before we start?
Well, thank you so much, Preeti, but I've been using medicines and I don't think that seems to work for me. You know, I've been having this pain in my lower tummy. It's been 5 days now and it's bothering me too much. Initially, the painkillers did work for me, but I see that since 2 to 3 days, it's been more severe and it's bothering me a lot.
Okay, is that okay to ask you a couple of questions? Because I can see that you're not very well. Would you like to lie down? Shall I give you some injections in your as an IV injection?
Sure, Preeti. If that can help me, then why not? Yeah.
Let me ask midwife and let me give you something first of all before we start the discussion. Okay.
Sure. Yeah.
Okay. So how are you, Sophie, now? Is that okay? Is the pain okay now?
Yeah, I could say it's slightly better. Yeah.
Okay. So, Sophie, can you tell me about your problem a little more in detail to me?
Yeah, just as I told you, Preeti, it's been 5 days now. I don't know why it's like terrible. I've never had such pain before, and I've been a bit feverish as well. I think I'm feeling that I have fever. I think it's since yesterday, and also I've been having some loose stools and vomitings as well. I really don't know what is wrong with me.
Okay. Uh, may I ask you a couple of more questions before we start with the management and make a management plan for you? Okay.
Sure.
So, may I know how are your menses? Is that regular?
Yeah, it's pretty regular. I have like for about 3 or 5 days every month, and they are regular. Yeah.
When did you have your last menstrual period?
It was about like nearly 20 days back. Yeah.
Okay. Is there anything else you are visiting your GP for? I mean, from the last 5-6 days, you are taking some medication. Apart from that,
No.
nothing. Is there any family history of concerns that you would like to discuss?
No.
Okay. And have you been pregnant in the past any time?
Yeah, I've had like about one abortion. I think it's been like nearly 7 months now. So, I just had it like I do have a partner, so we were not ready for it yet. So I thought, yeah, maybe I should get it, aborted. So I did have one.
Okay. So can I ask you some personal questions regarding your sexual life, if you don't mind?
Yeah, sure.
Okay. So you just told me you have a partner. How long you have been together?
It's been like around 8 months now.
Okay. Were you seeing somebody in the past as well?
Yes, I did have like two partners prior to that, and each like was for about 3 months each, and then with my current partner, it's been like 8 months now. Yeah.
Okay. And have you any time in the past screened for sexually shared infections?
No.
Okay. Have you any time in the past faced the same complaints which you are facing right now?
No, Preeti, this is my first time I'm having all this. No, I've not had before.
Okay. Any type of vaginal discharges any time in the past have you suffered from?
No, not really.
Okay. Any bleeding after the intercourse after making love?
No, no.
Okay. I think I've asked you about the any family history of concerns if you have.
No, not really.
Okay. And a little more personal questions. I hope you don't mind, Sophie.
Sure.
Do you smoke?
No, I don't.
Okay. Do you drink alcohol?
Yeah, sometimes at parties, maybe. Yeah.
Okay. And any drugs for fun?
No, no.
Okay. Uh, you are living with your partner?
Uh, like we just meet a couple of times, but I live alone.
Okay.
So maybe
Okay.
maybe twice or thrice a week I meet him, but otherwise I live alone. Yeah.
Okay. So Sophie, in case if you require any help, because right now, according to your condition, I'm going to tell you what we are going to do with you. But in case in future, when you are discharged, you require any help, let me know. Okay. We have the help centers which can help you.
Yeah,
Okay.
sure.
I
Yeah.
hope you are not allergic to anything. Are you allergic to any drugs or any medication?
No.
Okay. Is there anything that you would like me to know more about you?
Well, I think I have to disclose something to you since you're my doctor. I think you need to know everything about me. Well, I've been working like a commercial sex worker. It's been like 3, 4 months now. Yeah.
Okay. And how is everything going? I mean, you didn't suffer any type of problems during that for which you visited your doctor or gum clinic?
No, not really.
Okay. Okay. Thank you, Sophie. Thank you for sharing the information. And let me take you through what is the plan because it seems that you are pretty not very unwell. The first thing that I would request you and I would advise you is to offer you is to get admitted with us. Okay.
Do you think
Uh,
that's necessary?
because we can see I have to take your observations first of all. I have to check you from your tummy and your vaginal area as well. Uh, because your condition seems little not very well, you have been vomiting, you have high grade fever. And once we have checked you, we definitely will rethink. But the condition at the present says it is better if you get admitted with us.
Okay.
Okay. So examination findings are with me, and I can see, Sophie, let me explain you a little bit. You are little feverish, your temperature is there. You have a little high pulse rate right now because your heart is beating very fast. That may be because of the infection in the body and because you are nervous also, and little the temperature is also there. The fever is also there. Now when we have examined you, we could see that your abdomen, your tummy is little not very soft, as usually it is, and also there is some swelling and some lump like thing which we can feel in your tummy.
All right.
Okay. Now, why this happens? First of all, let me take you through that. Might be there has been infection in your vagina, which has actually ascended up to your uterus and to the tubes and to the ovary. If you allow me, I can draw for you and explain it to you in a little more extensive way.
Yeah, sure.
Okay, so this is the way how the infection travels to the uterus and to the tubes and the ovaries. And when the infection is very severe, they usually form a little swelling, a mass like thing. And that is the reason you are having a too much of right side lower tummy pain. That is the reason you are having so much of nausea and vomiting as well. You are basically having these problems related to this lump which has been formed here.
Okay.
Okay. Now, how will we manage you? First of all, we'll require to run few tests. There will be a team of doctors who is going to help us and manage you. There will be my consultant. There will be some people who are related to the reports which we are going to do. Radiologist who is related to the imaging. Also, there will be people who will be taking one-to-one care because it seems to be little critical condition which requires your admission in an ICU.
Oh my God, doctor, will I be fine?
Yeah, you'll be fine, dear. Let me tell you that this requires an admission with some drugs to be given you through your nerve, through your these IV lines, and that will help you to resolve this. In case if we are not able to do that, in case if it is not well by the medicines, then definitely we'll require a higher imaging like CT and MRI scan, and maybe a surgical options may be thought of if the medicines are not doing their work. Am I clear, Sophie?
Yeah.
Okay. So let me tell you that few tests we are going to run. First of all, there will be because your last menstrual period was 3 weeks back. So first of all, I'll be checking your pregnancy test just to make sure you're not pregnant. Few tests on the blood will be done to check that how much is your blood, how much is your hemoglobin in the body, and few tests will be done to make sure that how much has infection spread to your lungs, kidney, how much is the infection in the blood, also your urine infection, to just to make sure that there is no urine infection. We'll be doing a urine test as well.
All right. Okay.
Okay. And we'll be running some medications to you. We'll make sure that we give you a bed as early as possible. Before even we have taken the blood samples, we'll start your management with the fluids, and we'll also make sure we give you best of antibiotics just to kill the bug which is causing these problems.
Okay.
Okay. Also, we'll be giving you some medications because you are going to be on the bed rest. So sometimes the blood becomes very thick and there are high chances they clot in the body. So for that purpose, we'll be giving you some medications so that the blood thinning is okay and you don't develop that problem.
All
Am I
right.
clear, Sophie?
Yes, you are.
Okay. So basically the thing is right now you require an admission in an ICU with one-to-one care and a multidisciplinary team of doctors taking your care. We'll be running few tests for you because ultrasound has to be done first of all, because your examination shows that there is some problem in the right lower tummy inside. So first of all, an ultrasound will be done, some blood tests will be done, but definitely because you are not very well, our first preference will be to give you an antibiotic as soon as possible, a shot of antibiotic as soon as possible, and making sure that one-to-one care is given to you, and we'll make sure that you are well soon. Is there anything, Sophie, which you would like me to address more?
No, Preeti, I think it's pretty much clear. Yeah.
Okay. So I'll just complete the formalities, and once we have given you the antibiotic, which is the first thing which we need you to give, we'll be putting some tube in your urinary bladder, also the water bag also, so as to make sure that whatever we are giving you has a relevant output. So these are the monitoring things which we need to do. Your observations will be taken regularly. You'll be giving medications, IV line. You'll be also given a tube in your water work so as to make sure that whatever fluids we are giving, we have to balance it. And because you are not able to take anything, you're puking, so we'll have to make sure that whatever nutrition is required, that we give you through the IV line.
Okay.
Okay.
All right.
So let me do your formalities, and let's take on from there.
Okay, sure.
Okay. Thank you, Meenakshi. Thank you, Sophie, for your time. Let me make the formalities and do it for you.
Thank you, doctor.
Thank you so much. So it was a very simple case, everybody. It was a case of a commercial sex worker who is suffering from a TO abscess, basically. She is very unwell. Might be the patient you come across in the exam, the role player you come across in the exam is not very nice in presentation and stops you in between when you are speaking, because they will keep on saying, okay, I'm puking, please. So you have to, whenever they are saying that, your communication should be very smooth. Stop at that time. Tell them if they require, ask them if they require any help. Tell them if they require, they can lie down also. Okay, so stop. Do not just keep on talking and talking just to complete your course, just to complete your station. They also know that you have only 10 minutes. So they will also make sure that they will allow you to complete the thing in the 10 minutes. Okay. So make your communication very smooth. If they have any problem, please stop. Do not use too much of medical jargon. You might have found in my communication, I have used a lot. That Meenakshi can tell. Yes, Meenakshi, did you feel anything I have used?
That urinary bladder is one thing, ma'am.
Yes. And IV line?
Yes.
Yes. Okay, so you have to make sure you are very careful in using your words. Do not use medical jargons. They will definitely mark you down. Okay, this presentation is basically our normal presentation, what mistakes we do. Okay, it's not 100% correct. So you have to make sure when you are speaking, you don't make that mistakes. Okay, then signposting is very important. If you ask sexual history, if you ask personal history, you have to make sure you signpost. Okay, this lady is in sepsis, so anyhow you have to make sure you admit her. Anyhow you have to make sure that you give her first shot of antibiotic before doing anything. She requires the sepsis 6 bundle. And definitely investigations, you have to always, whenever you are telling about investigations, you have to justify why you are doing this investigation. So communication has to be smooth. Make sure it should be free of medical jargons. You have to signpost any sexual history or personal history if they have, if you are going to ask. Because she's 22 years, so I didn't ask about the smears. That you have to make sure the age is very important, and reassure her that you are going to help her. Definitely she lives alone. She's a commercial sex worker, so you can offer your help also, that extra help if she requires, because she's all alone at home. That also the facilities are there and help centers are there who can help her. Okay, history taking should be very concise. As you know, we have basically focused on the condition, on her history which is required, her allergies. Asking allergies is very important. And all the females of reproductive age group who are presenting to you with the pain abdomen, do a pregnancy test. Okay, so history has to be concise. As I told you, whenever you are asking history, you have to make sure that at relevant points you have to signpost. Then applied clinical knowledge. This patient will require 100% admission, and she will require all these things. And whatever you are saying, you have to make sure that you justify that why I'm going to do WBC, why I'm. So you, in general, as we talk, that we will do some test to make sure your infection is not there in the blood, your kidneys and livers are not affected. We'll send it. Definitely have to also use the word, we'll send it for seeing which bug is causing this problem. So blood culture you have to send. These points you don't have to miss. Sepsis 6 bundle you don't have to miss. Okay, and if required, we'll be sending few tumor markers. If you are not very sure what this mass is all about, we'll be taking swabs from vagina, which I think I missed, and higher imaging if required. And lastly, you have to make sure that you mention about the sepsis 6 bundle, that we'll put you in ICU with one-to-one care. There will be an MDT team. We'll be charting you. We'll be giving you the flows. We'll be making sure that antibiotics are given, the oxygen is given, the charting is full, the input-output charting is full, and thromboprophylaxis. And if you are not getting better, then we may require to take you for the surgery as well. Okay, so this is a little thing that all the students have to understand when they present the case, such cases in the in exam. So make sure that whenever you speak with confidence. Whenever you speak, make sure do not use medical jargons. Look, abdomen and vagina, they are good points. They understand. Even bladder, some people say it's okay to say bladder also. But okay, there's a trend to say water works, it's okay, you can say that. But otherwise, these people understand these basic things. Okay, so you can go on with that also. If you say tummy or whatever, that also is not wrong. But lower down below, don't say vagina. They well understand the word vagina. Okay, so make sure your presentation goes smooth in 10 minutes. Again, I'll say one thing. They also know that you have to complete the station in 10 minutes. So even if they are doing a little crying or drama or vomiting, they will automatically stop by their own. But definitely, if there is something they are crying, offer glass, they are crying, offer tissue. If they are puking, tell them that, okay, take your time. Do you require some help? Shall I tell the midwife to give you some injections? Some things you have to make sure your conversation is very smooth and like you're talking to somebody in your own clinic. Okay, is there anything, Meenakshi, you would like to add on?
No, I think contraception
Yeah,
during
that
the
is very important. And
Yes.
definitely at the time of discharge also, even you have to mention that we'll offer you some contraceptives like condoms, so that you are safe with regard to the sexually shared infections in the future. So that is a very, very important point. Very important. Thank you, Meenakshi, for that. Look, when you speak,
ma'am.
in the flow, you tend to miss the things. So if you make a template of that, it will be very easy. Nobody is perfect, but
Yeah.
this point is very important. This point might give me a negative mark because I haven't spoken about condom. I'm not worried that she suffers from sexually shared infections in the future. Now she had, you will treat. In future also, you want her to get it and get treated rather than preventing her from getting it. Okay, so you will be marked negative in that. So make sure that these points with regard to SRH is very, very important. Okay, anything else, Meenakshi?
No, ma'am. I think that only regarding contraception. That's it. I think everything we have covered.
Thank you for that point. Yeah, very important. Okay. So guys, this was all from our side. I hope that you liked it. And if there is still any queries, you can join us in the study medic and we will be happy to tell you all about this. Okay. Thank you guys. Thank you so much. Thank you, Meenakshi, and thank you, Vishnu.